Hello, everyone. I'd like to begin by saying thank you for joining our webinar. And I would like to give the floor to my outreach member.
Hello, everyone, and welcome to Shifa Community Clinic's fourth outreach webinar. For those who may not know, Shifa Clinic is one of UC Davis's 9 student-run clinics that provides culturally tailored healthcare to the uninsured and underserved population of the greater Sacramento area. Alongside primary care, we also provide specialty care through our dental clinic, women's health clinic, dermatology clinic, podiatry clinic, and many more. Our clinic is located at 419 V Street in Sacramento, and we see patients through telehealth as well as on site. If you would like to schedule an appointment, contact us at 916-441-6008, leaving your name, contact information, and reason for appointment between Monday through Thursday. Or if you'd like to learn more about Shifa, you could visit us at shifaclinic.org. We are very excited today to present to you all this webinar focused on the Yemen humanitarian and economic crisis, as well as detailing methods of sustainable development for the future. Brought to you by our guest speaker, Summer Nasser, who is the CEO of Yemen Aid. I would like to thank Summer for joining us today. And if there are any questions or comments, please leave them in the YouTube chat and we'll be sure to get to it after the presentation. So without further ado, please provide your undivided attention to our amazing speaker.
Thanks for having me, guys. I appreciate it. I'm going to be talking about the humanitarian crisis, some sectors involving that, some challenges and solutions over the course of the PowerPoint presentation. I am going to start sharing my screen if that's okay. All right, awesome. Okay. I wonder how. Alrighty. We'll start that. So, as I said earlier, we're going to be talking about the humanitarian perspective in Yemen. And I think it's important to note that obviously the crisis itself is very complex and very challenging of its own. So I'm going to try to wrap something up quickly within about 20 minutes or 30 minutes max. And so a lot of people kind of take note of this photo, and this photo is a beautiful photo of a location in Hadramaut. And so I like to bring positive photos when I talk about Yemen, and so this is one of them. Just some basic information here. And obviously it's kind of just something that a lot of people need to know in case they don't. Yemen has a population of about 30 million, roughly 29 to 30 million people. Essentially, the population really revolves around youth. Over 60% are youth. You'll notice also that the location is very strategic. So we're right below Saudi Arabia, very close to the Horn of Africa, and in between two strategic maritime security points. So it's between the Arabian Sea and also the Red Sea. You'll notice here, I don't know if you guys can see my mouse going up and down, but essentially the southern region of Yemen usually has the largest landmass. And so interestingly though, it doesn't have the largest population count. What you see here is the north and central Yemen specifically will have around the majority bulk, which is around 20 million people. Also, I always, want to always remind people that Socotra is also one of the islands of Yemen. So that's something I should always look into. Now, I'm not going to get into politics in here, given obviously the regulations, but these are just two really important chronological points that are events that happened in Yemen that created this type of situation that we're in now. And it's just two specific days. So September 2014, a coup run by Houthis have pretty much took over state institutions and, kind of went from Sana'a all the way down south to the city of Aden militarily. And then after that, by 6 months, you have March 2015, the Saudi coalition intervened based on the request of the president. And so regardless of the views here, we're just chronologically talking about certain events that really take a huge part in what's happening today. The humanitarian crisis is so different in Yemen, and I always want to kind of point this out. like, for example, when we look at Syria and we look at other countries nearby, Yemen is unfortunately unique in the sense where we have a lot of displaced people, and this is due to conflict. But the interesting part about this is that we really can't flee anywhere to neighboring countries. We're obviously surrounded by ocean, we're surrounded by Saudi Arabia, and also from the east side, we're surrounded by Oman. And so the place that I think some people would tend to go to is Djibouti, which is right in the Horn of Africa. And now there's actually some IDP camps there. The majority really just focus in changing locations between province to province depending on the conflict. So as an example, let's say if there's a conflict in New York, they'll move to New Jersey and so on and so forth to kind of go about their way. They usually, unfortunately, they'd rather stay within their own provinces or districts, and if worse comes to worse, they'll travel from province to province. 23 million are in need of humanitarian assistance, roughly around 80% of the population, and this is very, very a horrific number, because that means that the majority are really in need of some sense of assistance, whether if it's acute or severe. Now, this is one of the world's worst humanitarian crises since World War II. And that shows you how horrific the situation is. We have actually a non-existent health sector, and we'll go into that later on today. So this is really the bulk of it. The water sector is really important in Yemen. Internationally, though, there is a water crisis. So essentially, Yemen is no stranger to that. We've already had poor infrastructure prior to this war. Now we've had a more severe damaged infrastructure. Around 18 million people are in need of some sense of assistance, whether it's hygiene, water. And this is really, the water sector, if solved, will help solve many other issues like diseases being spread. And this really the key here. Water is pretty much the natural remedy for a lot of these diseases that are very basic, in a sense where clean water, clean access, clean hygiene would eventually kind of help solve that problem. And obviously, as we continue going on from camp to camp, and there's more refugees internally displaced, this makes a problem when it comes to water access, because areas that maybe have had water access are now overwhelmed with new refugees, and then that creates a lack of access for the whole area. Or they go from place to place that don't necessarily have water access, and so there needs to be some sense of intervention. On top of that, we have low capacity water networks, which means basically it's a public infrastructure issue. Sometimes water cannot be sent from, let's say, the field all the way up to a mountain. It's very complicated in that sense, and there needs to be some sense of intervention to kind of support that layout. The health sector is really non-existent, as I said, and I actually took a trip to Yemen in 2019, the summer specifically, and I focused on the health sector, because really the health sector, when it comes to any country, if there's no basic health care, and I'm sure you guys are obviously more experts in this than me in that sense, it really poses a very, very serious situation where kids, women specifically, don't get access to their doctors, whether it's maternal, whether it's just the basic OB, whatever it is, there's no healthcare system, or it's just completely depleted at that point. And so when I was there, I can't even explain to you how bad the situation was. I mean, we're talking about furniture that has crumbled, literally infrastructure that is holding by luck at this rate, not even necessarily by anything else. And then also we have, there was one situation that I was really, it kind of really hurt me the most, was doctors and lab technicians and things like that. They were using items that, and I kid you not, they were using items that were given to them during the Soviet Union days. And I am like mind blown, because there are even companies that they showed me, like refrigeration companies that you are US based, but they've closed down decades ago, but they're still in decent, status. But I think regardless of the situation, the fact of the matter is doctors are using rusted items, and just horrendous situation that I don't think and I don't know how they would kind of send themselves to a hospital at this rate, knowing that this is happening. And so we're talking about a very serious problem with the health sector. On top of that, they don't have any operational support. They don't have medical supply. They don't have any type of resources. And when they do get resources, we have to make sure that those resources are suitable for the power outages, which is a huge problem in Yemen. And I think this is what scares people the most when they get to the hospital, especially if they're in a life or death situation. We've had cases, not us as an organization, but we've seen cases across the board where people have been died due to the lack of power in hospitals. That on top of many layers, which is the health workers, they don't necessarily get paid. And if they do get paid, they get paid a very minimal amount. So you'll see, for example, a specialist in cancer or any type of specialization would get paid probably around $100 or probably less. And so they're not being paid to what they, on an education level, they're not getting paid what they deserve. And if they do, they still consider it rather, better than nothing. And so this is a very problematic situation. And I hope they don't normalize this, because that's not acceptable. And then we have a maternal issue in Yemen, specifically for pregnant women. And there's 1,000 maternal deaths per 68,000 pregnant women at risk. And this is really tragic, because when I also visited during the same time, I also sat down with midwives, and midwives were complaining that they didn't have the basic tools to prevent, let's say, blood loss and things of that nature that could have been preventable. But unfortunately, without the tools, they couldn't save the mom or the child for that matter. And so sometimes you would find organizations coming in to support them through kits and things like that. But again, it's short term, it's not necessarily long term. What you want to do is support hospitals with a department that is functional in a way where it's a long term solution. Most deaths are actually caused by communal neonatal situations, tragic events, and then also non-communal diseases, which we'll talk about later on in the process. So really, the health sector has layers and layers of problems, and the only way to really solve this is kind of taking a look back on the overall structure between the Ministry of Health and local hospitals and seeing what is doable versus what's not. We don't want to support, for example, a hospital, or we cannot support. I wouldn't say we don't want to or cannot. We can, but I think that what makes more sense in supporting hospitals is that if they at least get operational support, that's when we can intervene as an organization, because we also don't want to support a hospital for 1 month and then leave and then they close because there's no operational support. It just defeats the purpose. Diseases now between 2015. Roughly 2015 up until 2019, cholera cases have skyrocketed in Yemen. And it was actually one of the highlights, the unfortunate highlights of Yemen's crisis publicly on an international level. Cholera is a century-old disease. And it's really just spread based on lack of water, clean water. And so this is problematic again, because the cases rose given the public infrastructure damage and the lack of clean water access. And this is very problematic because again, it's easy to solve. You can have access to clean water. You need definitely hydration and things like that. I remember my father, for example, and by the way, this doesn't necessarily have to happen to people who are actually in Yemen. I mean, even if you travel, you also possibly can get it. And I think my father, about 2 years ago or 3 years ago, went to Yemen, an American Yemeni and very, financially well off. He got cholera. And so very easy to solve through some antibiotics and some IV fluids. But again, not everyone has this access. So just because you're not from the area doesn't necessarily mean you won't get it. It's just the problem is with resources in that way. Dengue fever, malaria, and forgive me if I say this wrong, but I think it's chikungunya. I don't know how to kind of explain it, but this is essentially both or all these diseases are really roughly rounded around mosquitoes. And this is huge because Yemen for the last 6 months specifically has been dealing with a lot of flood-related natural causes in the country. And it's something we haven't seen in a very long time, honestly. And probably it's because of climate change, and that's what we're assuming. But since those flood events, there have been a rise in malaria, and that's something we haven't seen in a while. It's around over 250,000 cases, and these are just recorded. Mind you, I'm sure there are so many other cases that are not reported, which means that, again, we'll talk about this later on, where there's lack of resources and items in the health sector to kind of give you the accurate numbers. So in all, we have various cases up to now, as you guys can see, and very unfortunate problems that, again, could be solved by basic necessities like water, but unfortunately we are in that situation where we've lost even the basic necessities on ground. So COVID-19, it's a huge crisis, right? Globally, not just in Yemen, but even here in the United States, we feel it. We've been on pretty much lockdown at this rate for the past 6 months. But essentially, the COVID-19 pandemic really was the pin in the haystack, or the last domino to actually have the whole domino line just completely fall in Yemen. And this specific pandemic really impacted the hospitals in a way where the hospitals that were essentially open, which is only 50% of the hospital numbers across the country, some of them ended up closing because they didn't have the support for PPE. They were not prepared for such a vast crisis, I think. And so that really kind of shook us all. And I'll give you an example. I had a family member or extended family member in the city of Aden, and relatively, she's about 60 years old. And she passed away because the ERs were closed due to the pandemic from lack of PPE. And so she had to go home, and she passed away at home. So we're talking about these basic tools that they don't necessarily have. And so it strained the private and public hospitals, not just private hospitals or public. So this is one aspect of COVID. And COVID really is a fight between policy and healthcare. I really think that it has to be synchronized in a way where both are working together to make sure that there's an impact on ground. And so here in the United States, you'll see on a state level, there are certain policies being taken to kind of prevent or limit the growth of COVID, and to curb the line on COVID. But in Yemen, we see obviously a lack of leadership. We're also looking at lack of authorities implementing policies for the sake of public health. And then on top of that, you're already looking at a completely almost non-existent health sector. And so in this situation, you'll find that in Yemen, there won't be support for wearing masks, for example, social distancing, things of that nature, curfews like we see in let's say, the Kingdom of Jordan. So Yemen really is in a fight on its own at this rate. And there was actually an individual who I kind of spoke to on the ground, and he specifically said, listen, I mean, really at this point, we've dealt with all these diseases, we've dealt with conflict, we've dealt with, on a day-to-day, we're living on a day-to-day basis, and COVID comes along. It's really, on top of everything else, just another thing that we have to deal with. And so it is what it is, So that's the type of mentality that we're dealing with. It's despair, it's lack of hope. There are a few people who do wear masks, don't get me wrong, but it's really the minority at this rate. And so we found in COVID, the cases are actually community spread. And while there are total numbers, there are actually reported cases, which is fabulous from my end. I really love to see reported and official cases. But this is very, very minimal compared to what the accurate numbers are on the ground. And the reality is that these numbers don't reflect that. Between government officials and in different areas, we see around 2,000 cases, and there's been deaths of 588, and then also recoveries of around 1,300. Now, this does not reflect it, because in the month of May, for example, we've actually had some data when it came to the death certificates that were being printed and signed off in the city of Aden, for example. Essentially, or at least prior to COVID-19, we saw that there was a death rate of between 10 to 12 people. And this was from natural causes and just any, not necessarily regarding any type of illnesses, severe illnesses like COVID or things of that nature. Now, the problem is that this is not necessarily public record. We've got to know this information through our sources. But during this, before COVID, again, 10 to 12 deaths. After COVID, starting in the month of May, we started seeing a number drastically increasing. So we've actually seen around 100, 112, 115, 120 cases a day of deaths. And so we knew that COVID was definitely spread in a very fast-paced manner across the community and residents. Again, we've had family members falling ill, lack of oxygen, and even oxygen itself is such a privilege in Yemen. And so people were either just being faithful and just dealing with it by themselves, or some actually just died from it. And so when you actually do speak to people from the authorities, they won't tell you how. Usually the death certificate would say, how did this person die, from what, or whatever. And unfortunately, they can't necessarily claim it as COVID because they don't have the resources like testing kits to make sure that this is actually COVID cases. But we are assuming that because of the skyrocketing number of cases that are considered deaths. Early on in Yemen, with the COVID-19 pandemic, we've had roughly the first maybe month, we've only had 500 testing kits for a population of like 30 million. It was absolutely ridiculous. And I think it was really laughable because, and it's unfortunate to say that because it's not appropriate to give 500 testing kits from UN agencies to Yemen for 30 million. Obviously, this increased over time, which we appreciate, but at the same time, again, doesn't necessarily reflect the accurate numbers. From about 53 COVID facilities, around half of them, about 25 to 30, are functional. Most of them are actually covered and supported by INGOs, and so there are a few that are supported by the Ministry of Health, but even the Ministry of Health actually agrees, saying that they don't necessarily have all the willpower to kind of control these and operate them in a way that should be. And so really the INGOs here are taking over the duties and of the state or the country and doing what they can. So we're looking at a very, very problematic situation. We don't have policy, we don't have governance, we definitely don't have financial support, and we have a incomplete and just a non-existent health sector. You'll notice also just the death majority. I personally like to see these data just so I can compare it, let's say from the United States data point. Death majority are obviously 16 over, as we know. Elderly always, unfortunately, have it the worst. And then the second is 45 to 59. This is actually the same when it comes to the United States, almost roughly the same when it comes to their data. So it's what I found interesting was that the age majority of cases were between 49 and 59. And so even though, again, because of the lack of resources and tools, we can't really say this is completely accurate, but it's the closest thing we have. But as we know from a research perspective and standpoint, children are obviously the most to spread it as quickly as anyone else. Food security. So Yemen, when I started to work on Yemen's humanitarian crisis, one of the things I realized was there's a lot of photos out there in Yemen randomly that just came up on a lot of INGO feeds and just the donation calls. And there's a lot of undignified photos of Yemenis out there. And I don't like to show this. I get it from I get it from one point, but also I don't understand it from another. So from the business standpoint is what they say. To get some sympathy for donations, you do have to show these types of photos. But the majority should not be that case. There are still people, they still have dignity. Yemen is a very tribal state. And so we tend to preserve that dignity just like anyone else would. But I think from a travel standpoint, we take it very, very seriously. And so you won't see that on my presentation. The food security problem has been enormous. And this is where the bulk of funds from UN agencies go to. 10 million face acute food shortages, around 2.5 million face acute malnutrition. Then also you have around 350, 400, give or take, children malnourished. Now these numbers, and I really want to say that the UN agencies have done a better job in food security when it came to limiting specifically malnourishment. And I think this is one specialty that they've done really well. They have very good facilities on the ground to prevent this. And as you know, we cannot, even as organizations, we cannot feed, let's say, a family who's malnourished with the same food that a regular family who's poor gets. And there's certain type of food, nutritional, items that they do have to take in to prevent any type of severe illnesses on top of malnutrition. So this is the bulk of food security on the ground. But one thing I do want to talk about later on is the challenges, which is a problem in all of these sectors. Women and children are always victims in any conflict. That's wherever you go, Yemen or non-Yemen, it doesn't matter. They're always the first to feel it the most. And over 3 million people, 3 million women and girls are at risk of gender-based violence. Again, we're talking about a country that in some way, actually, men are the prominent group in terms of protection, in terms of, let's say bread, having income for the family. And a lot of these men have lost their lives in crossfire, or whether fighting or whatever it may be, they've lost their lives. And so this puts more burden on women who have been really throughout their lives allowing or giving every responsibility towards the man to do what they need to do for the family. And so now women are stuck in a way where they have to think about now their children and economic future. But at the same time, again, there's a problem with that because a lot of jobs, there's a limit of jobs for women on the ground. So this is a cultural thing, which we hope to break soon, and we have been, but essentially this is one of the biggest problems when it comes to this situation. Then young girls are unable to go to school. This is a huge problem when it comes to generational advancement. And obviously war does this, but that doesn't give an excuse. I think at the end of the day, young girls are not only unable to go to school for the reasons of economic situation, but even females are usually the ones that go into agricultural sectors, the one that deal with water. And so young girls are unable to go to school because they're either working in the field or the security situation is really, really bad. And also, girls end up going to walk miles and miles just to get water for their families. And so in this situation, it becomes problematic. And when you actually support a well in Yemen, you're actually supporting also a girl going back to school. You're supporting them to focus on their daily lives rather than focusing on survival. And so this is really something that should be kind of talked about in the near future. The challenges, and I love talking about the challenges because really it's the main bulk of why we're still stuck in a very severe humanitarian crisis today after 6 years of conflict. Now, conflict does definitely play a huge part on this, right? Whether it's blockades, whether it's crossfire on the ground and just instability all in all. But the majority of the population now are depending on humanitarian aid, and this is huge. Even as someone who runs an organization, I can tell you this is something that bothers me on a day-to-day basis. Right now, if let's say, well, it's actually happening. So UN agencies are limiting or lessening their programs. This means that there's not going to be a lot of support that used to be on the ground. Also, a lot of jobs are going to be lost, which is a huge problem because a lot of the jobs that are now at the height of, I would say, success and just a great number in the job sector is humanitarian agency positions. Now, their positions have created a sense of larger, because again, flooding of money in. You also see a lot of that on the ground. And so positions have now, their salaries have, like, I would say, just went up maybe 200-300%. And so when you have a population really holding on to humanitarian aid as a source of whether it's economic stability or food security or whatever it may be, it becomes problematic when they're gone. And so this is a very big problem. And I really think that when this conflict ends, and I really believe that every conflict does end historically, I really fear that the biggest problem we're going to have is as much as it sounds horrible now, I really think it might get worse over time once these agencies do leave. There is a limited focus on sustainability, and this is one of the reasons why our numbers in Yemen are not getting better when it comes to food security, when it comes to the water sector and diseases. You'll see that most of it is the status quo humanitarian organizations. What they do is they send, for example, food baskets and on a month-to-month basis, but we don't want to do that. We want to make sure that at least if you're going to do food baskets, try to kind of take the same people and prolong the program to it could have 6 months at least, so that way they can get some sustainable nutrition. But in many cases, it's a 1 month thing, and then the next month they starve. And so this is very problematic. It's not a solution. And this is where we notice that there are temporary solutions in Yemen. And this is no matter how much money we bring into Yemen, no matter how much we do, temporary solutions will never be sustainable in a sense where it'll give you long-term results. And so this is really the problem here. We also have low operational support. And I'll give you an example of this. There was an incident that we faced as an organization where we supported a hospital with an ambulance, EMS service. And so after a few weeks of trying it out in this hospital, we've noticed that the location geographically was too complicated because Yemen has a very complicated geographical landscape. It's very mountainous. And so the vehicle itself was not a fit for that type of road. So we moved it to a city hospital. Now, another agency then came in and gave let's say an ambulance to that mountainous area. Now, what happened was that they gave the ambulance, but they didn't give them operational support, which meant that the ambulance was just sitting there, not doing what it's supposed to do. And so we now end up supporting this hospital operational support because of that gap. And so these are the gaps that we're talking about when we talk about international aid and how things should have been strategically placed in a better manner, but unfortunately that's not the case. And so when you have so much influx of money, this is what happens. Sometimes you just put there, any type of support and don't think about really the ramifications of that. And then the last is lack of economic strategies to rebuild, to rebuild Yemen in a way, Yemeni families. And this is really problematic. Again, supporting them and giving them everything is not going to help them overall. It's never going to be that, whether it's Yemen or elsewhere. You want to make sure that you give back their lives through dignified manners as they used to back before the conflict. And so this is where organizations should focus more on economic projects, sustainable projects, livelihood projects, whether in the agriculture, whether in the livestock area. And so we want to make sure that this focus really is the main talk point, because again, you cannot continue giving support to Yemen and expect it to be better through temporary solutions. It just won't happen. Okay. So this is actually a photo that we actually took probably a month ago, and this was after we built a we implemented a solar water well in Yemen. And so you'll see that children and girls, these are mostly girls in these areas, they are really happy to kind of get that access. And again, we try to show the positives of the Yemenis on the ground, but this is really the solution here. I'm actually going to show you guys a few videos. And I really think this is important because while we do work in the humanitarian sector from the urgent intervention side, which is fair and justified in various areas when it comes to conflict and urgent conflict, conflict that needs urgent intervention, we want to also make sure that other work that we do is also is also as important when it comes to sustainability. So we actually created the first ever breast cancer diagnosis center in Lahej. And this is a southern province of Yemen, and it has a roughly population of about 2 million. Interestingly, while I was there, they had to travel to the city of Aden, which is costly enough. So transportation, economic crisis is horrendous. And I guess I should have said this earlier, but really the economic crisis is the main problem in Yemen when it comes to food security, when it comes to just overall livelihood of people. Everything is so expensive. There is a lot of ample of food in Yemen. I really want to make this clear. There's ample of food, and this is why we tend to purchase in Yemen for food baskets and things like that. But the problem is people cannot afford it. And so this is where you see the realm of starvation, and this is where it's happening. The economic crisis really started in 2011, just as a back end of that. And so we want to make sure that from 2011 up until 2014, really the Arab Spring essentially started this process in Yemen. And so from 2015 up until, or 2014 up until present, the conflict just really kind of created a fast-paced motion downward towards the economic crisis. Inflation is absolutely ridiculous. And so this is where the bulk of our problems are. And so again, no matter how much we support, if we don't support, if government doesn't understand the solution is really important from a political standpoint, we can't do anything from a humanitarian standpoint, at least long term. So one of the things that I realized in Yemen is that a lot of projects are not given, I would say, quality. And I think quality is important in Yemen because you also want to welcome women in a center or an area that's comfortable for them. And frankly, if I was living in Yemen, I would love to go to this center. I really think it's awesome. But again, it's about warm, a nice, comfortable feeling. You don't want to enter a place that's falling down and just, just falling apart. And so this is one video, and just hopefully it will go through. I'll pull it up from our Twitter account and let me know if you guys can hear this. Let me see. I don't know. Okay. Oops, my fault. So this is one video that I'm really, really proud of because one thing that I really loved about this was, first of all, you want to make sure that you're giving awareness to this issue, breast cancer. I mean, it's a very problematic very problematic issue on the ground. And the thing is that we have cultural taboos, which, and again, it's not even culture. I think even us as women, we tend to be afraid to go get checked up because we want to make sure we don't want any bad news. And so we want to break that taboo and say it's okay to get checked. It's actually a great thing to check yourself and make sure everything is okay. And this is actually free of charge. So everything that we do here is free. And what I like about this is actually now the center actually has a better system in place in the main city of Aden, which is technically the temporary capital. So we actually broke a barrier there. The second video I want to show you is talking about supporting villages with water access. One of the things that we've seen in Yemen is that while there are some public wells, they need support in pumping, they need support in the network itself. And when we talk about the fuel crisis in Yemen, we want to kind of explain that it's not just transportation that's getting impacted, it's also the public sector when it comes to the infrastructure. Fuel, unfortunately, in this situation, or at least the water is dependable on, or water access is dependable on fuel. And if you don't have that, how are you going to supply homes with this? And so this video itself is part one of various videos we'll be sharing throughout the week. We've supported about 14 villages and actually lowered the overall rate and value of water from 600 riyals Yemeni, which I think, I don't even know, it's probably like, I could be lying here, but it could be like $5 of some sort, now over to 200 riyals, and that's 150 to 200 riyals, which is a huge deal, especially in your area where economic situation is pretty bad. All right, see, hopefully this will go through. All right.
طبعا المنطقة واسعة الأطراف ولدينا أكثر من 525 مشترك. طبعا مرحلة الضخ بالمشروع مرحلتين، وهذا ما يسبب تكلفة بأسعار المشتقات النفطية. طبعا توقف المشروع أكثر من مرة نتيجة المضخات، نتيجة ارتفاع المحروقات كذا. والآن يفضل الله أنه أدنى تشغيل المشروع بعد 2014 استمر التشغيل المشروع، إلا أنه فترات متقطعة كانت تشغيله. على أساس يتركوا طبعا منظومة شمسية بتكفي أعباء المواطنين هنا، ويكون إنه الكل ممكن الإشبار ممكن بأسعار رمزية، أسعار العدد أسعار رمزية، ما يكون بنفس السعر. يعني قد تطلع سعر الوحدة ل 150 ريال أو 100 ريال.
So that is one other project that we're doing, and water is actually one of our priorities at Yemen Aid. And the reason is because, again, that's where we can actually help the disease problem that we're seeing in Yemen. That's where we can actually support families by allowing their kids to go back to school rather than being absent just to collect water from families. And so we've done numerous projects in this sector. We've done, I think we probably took over the coast at this rate from all the water wells that we're doing with solar energy. And again, using green energy important because a lot of people don't have access to electricity. And so we want to make sure that they're advanced in a way that they're protected and it's limited maintenance so that way they don't have to deal with it. Now for the agricultural sector and the food security sector, again, you don't want to always support, you don't want to always give the temporary solution by giving them just a food basket and run, and walking away. We want to make sure that we're supporting farmers do their work that they have always been doing but have been stopped due to lack of just the basic items that they need to kind of grow their produce. And so one of the efficient ways of doing this is greenhousing. And greenhousing is not something common in Yemen, and so we're changing that aspect on the ground. And greenhousing proves to be one of the best solutions when it comes to economic support. So you're helping the families grow back their economic support when it comes to produce, selling that, whatever they're eating from it, it doesn't matter. And then also we want to make sure that we're educating farmers in better farming tactics. And these are really important. So I will, oops, okay, post that for you.
هذا ما قد زرعناه الكلام الصدق كله هذا الوقت كلف عندنا اول اسبوع مبحنا من 6 سلات وبعدها من 10 سلات والاخير بعدها من 12 سله المهم وصلت لها حوالي 25 سله و30 سله الصراحه يعني انا بعد ما شفتها هذه ما هي الا زراعه داخليه بهر صدق اللي كان بعض الناس بينتجوا طماطيس هانئ لكن ما شوف لها هذا بدتي لا حق الشمسيه اللي خارج غير المحميه. البيت المحمي يستمر مدة كبيرة يعني تجيني من مدة كبيرة أو فيها دخلها ثاني متغير عنها يعني بالنسبة للخارج تدي لك فترة معينة وخلاص تنتهي. إحنا بنسكيها بوسيلة تقدير يعني على شكل تقدير يعني اللي خرائط بنقطرها كل يعني بنسكيها في اليوم مرتين. يعني مثل ما تقول عندما تسكي بالغم حاجة بالنسبة للتقدير حاجة بسيطة. ولا يعني تاخذ الربع من على ونشكرهم على هذا الخطوه التي قاموا بها والفكره اللي جاء حتى الفكره اللي جابوا فكره بالنسبه لدعم المزارعين فكره جيده واستحقوا علينا كل الشكر.
So that was basically the agriculture and farming sector. We do water irrigation as well, which he noted. But this is something important because and actually this video only shows one. We did about 50 greenhouses and we'll have more videos for that over time. But it shows you that, just through creative ideas and basic, sustainable projects, you can actually do much more impactful things across the board. Now, from agricultural perspective, that was done. Now, from an economic livelihood project or focus, you want to make sure that even those who were in Yemen especially, there's a lot of farms, we have a lot of space, and we have a lot of land, and a lot of farmers end up doing either produce or livestock, and livestock proves to be very important in Yemen because really that's we're meat eaters, frankly. I mean, that's just who we are. So economic livelihood focus on just a livestock project, supplying a family with, or a farmer with, let's say maybe 2 lambs, and then they take care of them in a way where, because one thing I learned over throughout this process is that a lot of the goats die very quickly, and there's reason for that. We're not properly taking care of them. So in this matter, we teach them how to protect their animals and livestock, but also how to make it grow, eventually sustain them from for economic livelihood. This is the last video, I promise.
الدولار الحين قال 5 واحد ما الحبلة ترجعها مات عليها الثالث للحين قاعد لا نحصل له شوية حليب ما علينا شيء. صرنا من الحليب صرنا إذا انتهجين وبعد كثير تبيع أو تصبح قاسمنا الذكور أما نزلت على تربية حيوانات أشكرها لأني تفاعلت مع المواطن وساعدته في خاصة في الوقت الحاضر. حصلت منهم شكرا لهم 300 وشكرا لهم جزاهم الله خير نفعلهم لا كله يوم جايبين العشاء يجيبنا غنم فوق الغنم وفي بركة.
دعمتنا في البداية ب3 دوس من الماعز الحمد لله الحين لديها 5 ولد لي 2 واحدة أسقطت والحمد لله معي الآن 2 حبالة ثانية إن شاء الله يكونين إذا أراد الله حسب. كما نشكر من أعماق قلوبنا منظمة يمن إيد.
جزاكم الله خير الله يديلكم العافية وابني مسكين يستفدلوح إنه مسكين مع معاش ولا شيء معاه وش معه معاش.
So that just shows you that when you support a family with 1 or 2, it can definitely be successful in a way. They'll have 7 or 8 or 10 animals, and I'm not going to be surprised if I see this family again pretty much in another year with maybe 15 or 20. And so these are the type of solutions that you want to focus on when it comes to Yemen and how we move forward. I guess that's it, but if you guys have any more questions at the end of the conversation, I'd be more than happy to answer them. I'm going to end the screen. So let me, stop sharing. There we go.
Thank you so much to Summer Nasser for the very informative presentation and for sharing those videos. And honestly, just for being here on this Saturday to shine light on such crucial information and making it easily accessible for our community to learn and be aware of, like through this webinar. So we'll go ahead and take some time for some questions. The first question is there a lot of government support for these programs, or is it solely based from donations?
So the ones that we are doing as an organization, they're purely public donations. I mean, as a U.S. charity, we tend to do that. I wouldn't say that there's government grants, if that's what they're saying, but the government does support them and support us in terms of, and local authorities for that matter, anywhere we go, for making sure that certain areas are safe to go, there's a need, and we always monitor that need and reinvestigate just in case. But that's something that we do have to go through. So the authorities do give us the approvals to kind of go ahead and do it, and they support anything that helps Yemen. So that's the bulk of it.
I'll give it some more time for some questions to come in. Okay, I believe those are all the questions we had for today. But if anyone has any more questions, you could always feel free to email us. And thank you again to our guest speaker, Summer Nasser, for being here today and taking the time to speak with us. We'll finish off this webinar by providing you guys with some resources to help yourself and others from a representative of our Health Education Committee, Resham.
Can you guys hear me?
Yes.
Got it. I think there might be one more question I on to. I'm not sure.
Oh, yes. We do have one more question. As external people, what is the most respectful and effective way to go about giving aid? Is there anything we should absolutely not do?
I would say first do whenever the public wants to support a charity for Yemen, definitely do your research on who they are, whatever it may be, whether it's Yemeni or somewhere else. At the end of the day, all of our organizations that work in Yemen all want to help Yemen. So regardless of where you go, just definitely do your data, because unfortunately in Yemen, there is a weaponization of aid. And so this is problematic, especially in different areas across the country. You'll find in the north authorities, and I think the US aid wrote about this, and the UN also had been open about this more recently, where there's an obstruction of aid, utilizing it for political means. And so we want to make sure that that doesn't happen to our aid. Meanwhile, in the central and south of Yemen, different authorities, again, government side, I don't see this happening, honestly, specifically because we actually are headquartered there. So what I would say is don't just give because of somebody emotionally kind of stirred you. See if it's effective, what they've done. And then also make sure that their financials are there. Financials are so key. And so make sure that that's in place. But definitely talk on social media about Yemen. That really helped a lot, especially in June and July. There was a trend on Yemen, and I don't know where I'm still kind of dumbfounded about how that even started. But I think it helped tremendously. There was a lot of people talking about Yemen finally, and it was it's better late than never, but they actually need a lot of help. And it kind of pains me to say this as a Yemeni American, because we've never thought we would actually be public and asking for support. We're a country that's really would rather kind of unfortunately suffer than to ask. And so this is where we come along. But I think at the end of the day, talk about Yemen, see what the sustainable solutions are, and talk to a Yemeni. I think that's pretty much how you go about it.
Thank you. We do have one more question. Is there any other ongoing projects done by your organization? How can we support the work you do?
Yeah, of course. We do EMS service as well. I could not show you the video because, first of all, it's still an editing phase. And then also I bombarded you with a lot of videos already, so we're not going to do that. But we're actually working on a new website. And in the new website, probably it'll be live in about 2 months, where you can actually sponsor these projects that we're looking at right now. We work in various sectors, like I said, and we're starting a social sector and social development fund for women. And so this is really important. It takes a lot of more work, and it's more sensitive topic. So we tend to kind of make sure that it's well out there in a way that it's presentable. So yeah, I think definitely visit our website. Email us. Honestly, we're very talkable. We're not, those types of organizations that don't really respond, or we try to do as much as we can to respond, and see where your donations are going and what you want to allocate it to. Whatever you allocate it to, we have to allocate it to that department or sector. So.
Thank you. I know I said that was the last question, but we did have one more roll through. What was the most memorable project you've worked on thus far?
Honestly, the ones that I've showed you, frankly. Those were the top 4. The breast cancer was the first video and first project that we actually did that made us very proud. And honestly, the EMS service, so we've actually started an ambulance services in Yemen, and so in areas of siege as well. So the areas that need the most emergency medical attention. And this is a 24/7 project service, and it's free. Everything that we're doing is free. So, and it doesn't cost much. It's about $1,500, I think, a month of some sort. And I could be wrong, but it's around that number to support 6 employees. These programs also give employment. And so this is really important. So these are and I love watching them. It makes me smile. And I think you've seen me crack a smile or two when I was watching these videos, because it's nice to see that the things that you're doing have a result. And that's what's important for us. It's not about 1, 2, 3, overnight we get something, we post. It's about you waiting a few months to get the best results of it. So I think those are the bulk videos that we really are really proud of, and we're going to continue doing as well.
Thank you so much for that. So we'll go ahead and let Resham take it away.
All right, guys. Okay, well, again, thank you so much, Samar. This was a really insightful presentation. I definitely learned a lot. And so to just wrap things up, in order to gain more information on the resources that we have, such as the infographics that we have made here at Shifa Clinic, you can go ahead and find them at our website, shifaclinic.org. And then for now, please tune in for our next webinar taking place on this YouTube channel on Sunday, November 1st at 4 p.m. And yeah.
Thank you to our speaker again, and thank you to our viewers for joining us and all of your wonderful questions. I look forward to seeing you all soon on November 1st.